Alright, good morning everyone, and welcome to a Medicare Insurance Finders production pertaining to what to know about Medigap Quotes. Today we're going to be going over some of the highlights and things that people need to know about Medigap Quotes, the 5 points that you must know before getting an application, and then also what should a Medigap Quote look like and what should you know about the company and the different about the plan design before you enroll. So let's get started. First thing, what to know about Medigap Quotes. First of all, Medigap plans are standardized. This means quotes are very important. The benefits are the same on plans A through N in 47 states, all but Minnesota, Massachusetts, Wisconsin. And so it is important. Price is crucial. They even tell you in the Medicare and You booklet that price is pretty much the determining factor between these Medigap quotes and Medigap plans. Quotes vary by different factors, usually date of birth, tobacco usage, gender, and zip code. Now, there are states where this does not apply. You have states such as Connecticut where there are no health questions, New York, and Washington, a few others. Arkansas's got community rates. But in most states, the date of birth, tobacco usage, gender, and zip are the determining factors. A high quote does not mean it is better coverage. These benefits are standardized. So Blue Cross Blue Shield, Mutual of Omaha, AARP, Forethought, whoever it may be, offers the same coverage on a Plan F. Nothing is different. Same coverage on a Plan G, Plan N, Plan C. These plans do not vary in coverage. Don't just get one carrier quote. Don't just say, oh, well, they're going to be the best. I've had group health insurance with them for years. That does not mean they're the best Medicare supplement carrier because a lot of it comes down to financial stability and price and also their loss ratio. Medigap carriers, quote differences. 5 points to know about Medigap plans. 1, choose a secure rated carrier. If they're not B+ or higher, don't go with them. They got a good chance of having some financial struggles. They have financial struggles. That most likely means your rates will be going up. 2, benefits are the same, so rates are important. We just went over that a minute ago, so I'm not going to hit on that too much more. You need to reevaluate your Medigap plan every 2 to 3 years. What this means is that in most states you're an attained age, meaning it's going up on your policy anniversary date, which also increases with your birthday. A lot of carriers, the average right now across the country is 8.9% rate increase. This is in 2012, September. But a lot of carriers will bump it up much higher than that. You got some carriers are giving decreases because their rates are so high, so it's kind of leveling those out. A lot of people their first year will get 8 to 10% rate increase, and then they'll get a 12 to 20% rate increase the following year. This is common, but that's why you need to reevaluate your Medigap plan. If you cannot switch due to health conditions, you need to check out the BAI Senior Choice Plan. That's Benefits Association Retiree Medical Plan. It's mimicking a Plan F. Great product out there. 4, just because it is AARP or Blue Cross, it does not mean they are better than other carriers. We hit on that a minute ago. Just because you've had United Healthcare, Humana, or Blue Cross or Blue Shield, whoever it may be, as your provider does not mean they will provide you with better coverage. High loss ratios. It means equals high rate increases. So you want to choose a plan that's not getting a ton of bad business. A lot of times if they're the very lowest Medicare supplement plan on the market, they're going to get a lot of bad business. We'll hit on some of the plans to consider to prevent high loss ratios as well. So how to save on your Medigap plans. Okay, I would recommend you looking at a Plan G versus a Plan F in your area. The differences in these products is only $140 deductible in 2012, which is the Part B deductible. Even if it goes up, you're still going to be looking at lower rates. Most of the time, these rates are going to be $200 less a year, and we've seen them up to, well, I think it was like $500 a year difference for only a $140 benefit. So you need to look at Plan G to see. Another big benefit of this Plan G is that it is not a guaranteed issue plan, meaning those coming off a group health plan or losing Medicare Advantage cover or one of the 7 or 8 guaranteed issue rights. You cannot get a Plan G, only Plan A, B, C, and F. So with that being the case, Plan G has a healthier block of business. Now, they still get people that are in open enrollment that may be unhealthy, but it's definitely worth considering, and Medicare Insurance Finders can help you with that. Go to MedicareInsuranceFinders.com. Again, MedicareInsuranceFinders.com, and the advisors there are trained on this and know how to help you with this. All right, what a good evaluation looks like. I'm using Medicare Insurance Finders because that's who we are. We represent 47 states, provide quotes with over 20 different Medicare supplement carriers, and we're appointed with over 75 different carriers. But what you would want to do is click here. I'm going to highlight this area right now. You want to go to click here, and this will allow you to fill in some basic information. Remember that date of birth, gender, tobacco usage, etc. that will give you the accurate quote. Here you can see the different carriers that pull up, their rating, the plan, the monthly premium, and the annual premium. Here you'll see for a 65 male, the difference between the top rated carrier and the bottom rated carrier is $600 a year. $600 a year, and there's no difference in benefits. Also on this, you can see here where there's the select plan. You can click this and choose the different plan types. It defaults to plan F because the fact that plan F is the most popular plan, but I would definitely recommend you get numerous quotes with numerous carriers, and this is a great way to do it. Again, we are Medicare Insurance Finders. Our toll-free number is 800, another 800-1397, option 6. Our website is MedicareInsuranceFinders.com. Our email is seniordivision@morganwhite.com. We're here to help you with all your Medicare insurance needs and look forward to working with you. Thank you very much.